Welcome back to the morning show here on Rise News. Joining us now for our take are our guests of the day, Dr. Nini and Mrs. Timmy. Now, we're talking about healthcare, we're talking about blood, we're talking about prevention. Yesterday, this happened to this youth corporal, Miss Linda, who was supposed to pass out today, and unfortunately, she bled to death. And that was because she was not treated by the hospital because they didn't have a police report. Now, things like this sound very ridiculous and very sad that they're happening in 2018 in Nigeria. Now, you told us about prevention. Now, obviously, we know the prevention would have been to treat her. And if a Life Bank was there and they were also, they were happy to actually assist the lady, Life Bank would have been able to give her blood. Now, what is really going on in our healthcare system? Is it really just the government, or is it is it just solely the government?
I think we need to change a bit of some policies. Like there's no need for this girl to die. There was no need for her to die yesterday. If someone comes in a critical condition, the first thing is to treat first.
Yes.
As doctors, we should treat first and ask questions later because the person's life is on the line. But it's sad that this is how we lose lives daily in Nigeria. And, our healthcare system, we're doing very badly. The World Health Organization rates us at 187 out of 190. So basically, we're last,
Wow.
And that's really poor. I think we need to change some of the policies in healthcare right now because...
So on that, historically, that was a problem. So if somebody came in with a gun wound, that somebody got hurt because of a crime, and the doctors helped them, they would, the police would sometimes arrest the doctors. So that was the problem. So doctors started asking for a police report first. But the law was changed 2 years ago. So Nigeria passed the National Healthcare Bill, and in that bill, the government said, treat first, and no one should arrest you just because you helped somebody. So it is unfortunate. Sometimes the law changes, the policy changes, but the information is not passed along to the people who actually must sort of implement that policy. So it's really, really, really sad. We lost a life, a young life. Yeah. We don't know what she could have been, in the future, and it's a tragedy for this country.
Yeah, because we don't even know why she was...
Sometimes it's not even a gunshot wound. She could have had no money, and then they won't treat you because you don't have the money. I'm like, what year are we in that you have to request for money first, And that's why there should be this national health insurance scheme. But since 2005 it was implemented, only about 5% of Nigerians still have that national health insurance scheme. Yeah, and most of them are government workers. Yeah. So there's no policies in place. People are not, they don't know about it.
They're not aware.
They're not aware of it. There should be billboards, See how we're talking about PVC, get your PVC. You should be talking about get your health insurance, get your insurance in check so that you could walk into the hospital boldly and not even just walk into the hospital. The government should put more funding in the healthcare system, In a country like South Africa, we have, each citizen is, they have $300 for each citizen for their healthcare. In Nigeria, we have 1,800 naira per person. What is 1,800 naira going to get somebody? What treatment is 1,800 naira going to get somebody?
And a few years ago, we were part of a group of countries that came together and said they would take 5% of their budget, of their annual budget, and put it towards healthcare. And we signed that. We signed that agreement, so it's in the books. But I don't think we're even up to 1% of our budget is structured towards healthcare. Yeah. So healthcare is highly uninvested in.
Yeah, and it's like misplaced priorities.
Yeah, misplaced priorities.
PVC.
Yeah, everybody, talking about PVC. We should put that much energy into making sure that people, it's the human right issue at this point. Exactly. I have a right to get health care or be attended to if I'm sick, but at this point, nobody really takes it that important.
Yeah, well, it's
really sad.
It's really sad. It's almost like they don't value lives here. And
exactly.
It's quite unfortunate.
Absolutely.
Well, thank you so much, both of you, for joining us, Dr. Nini and Tebi from Life Bank. Well, it's time to wrap up the show. Unfortunately, we don't like to say goodbye until tomorrow, though. Thank you for watching the morning show. All that's left to say is have a great morning and enjoy the rest of your day. Goodbye.